One I'm going to discuss here is carbonation and your stomach after weight loss surgery. So this is a hot topic. Depending on what your surgeon's thoughts are, your dietitian's thoughts are, you can get different information, and depending on where you're looking online. Remember, just because you find a link online does not mean it's accurate. It also doesn't mean it's wrong, but you have to do some digging, you have to do some research, you have to make sure you have a trusted source. When in doubt, professionals such as myself are here to help answer these questions. So, carbonation. One, carbonation will not blow up your stomach in the literal sense of the term. It may feel like your stomach is blowing up. It can feel extremely uncomfortable. If you think about a really small balloon, right? And then you put in a carbonated beverage, which essentially that's kind of how your stomach is. That popping, fizzling, bubbling is happening in a very small space. And that can make you feel extremely uncomfortable. Does it actually expand your stomach? No, not in the way that you are thinking. But like I said, it can make you feel pretty miserable. Now, actual long-term damage, having carbonated sparkling waters, I am not concerned about that. What I'm more so concerned with is when people have regular sodas and even diet sodas, and that is because there's essentially no conclusive research on this, but from my own personal practice, I can tell you that individuals that drink a lot of diet soda typically have a weight-related issue. Now, this is kind of a chicken and an egg thing. You know, are they drinking diet soda and because they're overweight and they're trying to lose weight? Are they drinking diet soda and maybe the diet soda is causing them to crave other foods, other sweets, concentrated sweets and whatnot? We don't know. And to be honest, from my experience, it really varies on the person. I've seen some people that drink diet soda, and when I can convince them to go off of it for a little bit, they notice that they don't crave as much sugar. You know, they don't want as many sweets. For some people, it doesn't seem to have a big difference. It also depends on how much you're drinking. So if you're having one diet soda a week, I'm not overly concerned. If it's one 12-ounce can a day or multiple cans a day, then I do get a little bit more concerned. Again, this is not a hard science. Unfortunately, we just don't have enough research to make a conclusive decision on this as a community, and so a lot of it just depends on your medical professional that you're talking to. Again, I can only speak from personal experience, and I do see that trend. So in general, I do say stick away from your carbonated sugary beverages and your artificially sweetened carbonated beverages. So that's your Splenda, your aspartame, your sucralose, which is Splenda in another word. But plain sparkling water like a Perrier or a Pellegrino, even with a lime flavor, you know, there's no artificial sweetener there. It's just that flavor of the lime or the grapefruit or the lemon, whatever it is. I am not concerned about that. So I hope that answers some of the questions. If you are drinking carbonated beverages, you're probably going to want to wait until you're at least 4 months out from surgery. Again, just because everything tends to be so new, you tend to be your most sensitive. I would not drink carbonated beverages with meals as well. Again, that fluid kind of pushes the food through too quickly, which may cause dumping for some people, which may cause you to feel hungrier faster because that food is not sitting in your stomach as long. It kind of can push it through a little bit more. And it can actually kind of sometimes dilate, do it that way, dilate that bottom portion where your stomach connects to your esophagus, your esophageal sphincter. It can kind of maybe cause that to widen. And depending if you've had a gastric bypass, there's now a surgical connection there as well. So that makes it a little bit more trickier. So anyways, I hope again that clears up the confusion. If you have any questions or concerns, please, leave a comment and I will answer it for you. Thanks.